Hello and welcome. We are absolutely thrilled to have you as part of the River Valley Orthodontics family, and even more excited that you've officially started your smile transformation journey with us. Now that your orthodontic appliances are on, you're probably wondering, what's next? How do you care for everything? What can you eat? What should you avoid? These are all great questions, and we're here to guide you every step of the way. Taking good care of your appliances is essential for achieving the best possible results in the shortest amount of time, and we want to make sure you feel confident and prepared throughout the entire treatment. In the next few slides, we'll walk you through everything you need to know, from how to care for your braces, what foods to avoid, to helpful tips that will make your orthodontic journey smoother and more comfortable. So let's jump right in and get started. Let's talk about one of the most important parts of your orthodontic journey, oral hygiene. Now that you have orthodontic appliances, it's absolutely essential to brush and floss after every meal. Keeping your teeth and gums healthy during treatment not only protects your smile, it also helps prevent delays or complications in your progress. Be sure to brush at least twice a day for 2 minutes. Use a soft bristle or electric toothbrush. Hold your brush at a 45-degree angle, starting at the gum line, and work down toward the bracket. Clean all surfaces, front, side, back, chewing surfaces, and don't forget your tongue. Pay extra close attention to brushing under the brackets and wire. Replace your toothbrush every 3 months or sooner if the bristles are worn. And remember, just because you have braces doesn't mean you should skip your regular dental cleanings. Continue to visit your general dentist every 6 months for checkups and professional cleanings. If your dentist needs the orthodontic wire removed for any procedure, simply call us in advance, and we'll be happy to coordinate with their office to support your oral health. By keeping up with these simple routines, you're not only protecting your teeth, you're setting yourself up for the best possible outcome at the end of your treatment. A clean smile is a healthy, confident smile. A proxy brush is great for cleaning between brackets and under the wire. Focus on the areas that your toothbrush can't get to, above the hooks, and any small areas that are hard for your toothbrush and cannot get to. When it comes to flossing, we know it can be more challenging with braces, but it's just as important. Use a platypus or super floss to guide the floss under the wire. Gently floss between each tooth one at a time. We also highly recommend using a water pick or water flosser. It is an effective tool that uses a thin stream of water to remove food particles and plaque from hard-to-reach areas, helping to keep your teeth sparkling clean. Using a water pick or water flosser is pretty straightforward and can be a great addition to your oral hygiene routine. Start at the lowest pressure setting, especially if you're new or have sensitive gums. You can gradually increase the pressure as you get more comfortable. Aim the tip at a 90-degree angle to your gum lines. Glide the tip along your gums and between your teeth. Use for flossing, pausing 5 seconds between each tooth, front and back. White spots or scars on your teeth are signs of enamel damage, but the good news is most of them are preventable. These marks, often called enamel scars, usually appear after braces from poor oral hygiene. They're caused by plaque sitting on the enamel, which leads to demineralization. So how can you avoid them? First, brush twice daily with fluoride toothpaste and floss every night. If you're wearing braces, use proxy brushes or water flossers to clean around the brackets. Limit sugary and acidic drinks like soda and sports drinks. And visit your dentist regularly for checkups and fluoride treatments. By protecting your enamel now, you can keep your smile healthy and free of scars for life. Now that you've officially started your orthodontic journey, congratulations! We're sure you're wondering, what can I eat and what should I avoid? Great question! The good news is, with a little bit of awareness and care, you'll still enjoy most of your favorite foods. But while you're in treatment, it's really important to protect your appliances so that they can do their job efficiently and without interruption. Let's talk about the foods to avoid. These are simple because biting into the wrong things can damage your brackets, bend your wires, and delay your treatment. Avoid anything hard, sticky, chewy, or crunchy, including foods like hard chips and ice, sticky foods such as caramels and Laffy Taffy, hard foods like nuts and hard candy. These types of foods are hard and can break your bracket and bend wires. Foods that are safe to eat with braces are dairy, like soft cheeses and pudding, breads such as tortillas, pancakes, and muffins without nuts, grains including pasta and soft-cooked rice, meats like soft-cooked chicken, meatballs, and lunch meat, vegetables like mashed potatoes, steamed spinach and beans, and fruits such as applesauce, bananas, sliced apples, and sliced carrots. And of course, some treats like ice cream, milkshake, cake, and soft cookies. Your appliances are working hard to give you a beautiful smile. By being mindful of what you eat, you'll help keep your treatment on track and avoid necessary repairs and delays. And remember, if you ever have a question about whether food is safe or not, just ask us. Using orthodontic wax on braces is a great way to prevent and relieve irritation caused by brackets or wires rubbing against your cheeks, lips, or gums. With new braces, your mouth needs time to get used to them. If you have poking wires or broken brackets, wax helps reduce pain until you can get to the orthodontist. If you have mouth sores, it protects irritated areas while they heal. Here's exactly how to use it. Break off a small piece of wax about the size of a pea or smaller. Roll in between your fingers until it softens and becomes pliable. Gently press the wax ball over the sharp or irritating part, usually a bracket or a wire end. Flatten it so it covers the area smoothly. It should form a small bump, but not too bulky. Keep in mind, as long as needed, remove it before eating, brushing, then replace with fresh wax if needed. Replace the wax every day or more often if it falls off. Don't reuse old wax. It can harbor bacteria. If you have mouth sores, you can also use brace relief to numb and heal the sores that braces can cause. Let's talk about orthodontic emergencies. The good news is that true emergencies are rare, but when they do happen, please know that we're always here for you. What many patients are surprised to learn is that most issues can be managed at home temporarily until you are able to come into the office. For example, if you have a loose piece that can be safely removed, go ahead and place it in a small plastic bag or envelope and bring it with you to your next appointment. If something is poking or causing discomfort, orthodontics wax can be a great temporary fix. Just place it over the area that's bothering you. If a wire has shifted to one side, you may gently pull it back with clean tweezers or needle nose pliers and guide it back into the tube on the back of the tooth. Now let's cover a few common situations. General soreness is completely normal when you first get your braces. Your teeth and mouth may feel tender for about 3 to 5 days. Stick to soft foods and rinse with warm salt water to soothe sore spots. Over-the-counter pain relievers like ibuprofen can also help manage discomfort. If you have a loose appliance or bracket, leave it in place if it's still attached to the wire and use wax for comfort. If it detaches completely, place it in a small envelope and bring it with you to your next visit. A loose wire can sometimes be repositioned with tweezers. If it's too bothersome and repositioning it doesn't help, you can clip it with the clean nail clippers behind the lastly secured attached tooth. Then use wax to cover any sharp end. For a poking wire, try to recover it with wax to avoid irritation. After managing any discomfort at home, it's very important to give our office a call. Even if the issue seems minor, we'll want to schedule a quick repair visit to keep your treatment on track. Leaving a broken or loose appliance untreated can delay your progress. If you have general soreness, you can always do 1 teaspoon salt and 8 ounces of warm water and swish. You may have noticed a small blue bump on your tooth. That's what we call bite prop. It's a small plastic orthodontic device that plays a very important role in your treatment. Bite props are placed to help guide your teeth into the proper position while also preventing your top teeth from hitting your lower brackets. This helps avoid breaking or damaging them during your bite. While they may feel a little bit strange or uncomfortable at first, they're temporary and an important part of ensuring your bite aligns perfectly. Thank you so much for taking the time to watch our home care instruction video. We're so excited to have you as part of the River Valley Orthodontics family and to be with you every step of the way on your smile journey. We know this is a lot of information to take in, especially at the beginning, but don't worry. For your convenience, we've provided a comprehensive home care booklet today that includes everything we've covered and more. It's a great resource to keep on hand whenever you need a quick reminder. As always, if you have any questions or concerns, please don't hesitate to give us a call, text, or email us. Our team is here to support you and ensure your treatment is smooth, successful, and as comfortable as possible. Thank you again, and welcome to River Valley Orthodontics.